I nominated Xena because I think she goes beyond the call of duty to help people in our community, especially the travellers, to gain their trust, to build relationships with them and to make their lives better. It takes a lot of effort and time to build up good relationships with the traveller community, and in gaining their trust she's made the health visiting service important to them and improved their lives a lot.
Engaging with the traveller community is really quite hard, and it's taken some years to build up the trust, and that's based on the things that I can do for them, like organising appointments and acting as an advocate, and for them to understand that I am on their side and working with them. It's actually working with other professionals to help them understand the cultural values and the difference in culture that the traveller community has. If people understand their history and where they're coming from, and like I said, their cultural differences, then they treat them with better respect because they understand them better. The areas that make me particularly proud of working with that community are some of the very small successes that take years to happen. And as an example, I've been working for years to try and encourage people to use books, the mothers to use books with their children to help readiness for school. And yesterday, when I went down to see them, she was sitting there, she signed up for the summer challenge for books, and she was sitting there reading the books, and that's the first time in years and years that I've actually seen some of the travellers use books with their children.
During my apprenticeship, Karen has gone out of her way to make me feel comfortable in the environment I'm working in. When I first started here, I didn't tell anyone about having a mental illness because I was scared I wouldn't even get the job. But as soon as she found out, she went out of her way to understand what I was going through. We always talk about how I'm feeling, if there's anything I need to put in place. She's always going out of her way just to make sure everything's right for me in the workplace. So thank you, Karen.
I try to lead with compassion, respect and dignity because I think staff working in that environment will find new and better ways of working. We want our staff to treat our patients with compassion, so how can we expect that if we're not treating them in a compassionate leadership way? What makes me feel good about my role as a leader within the NHS is when I get home and I can feel that my team are happy, or if I've had a meeting with one of my team, I have a young apprentice, I've been mentoring her, and I get the job satisfaction of making sure that she's okay, that she's doing well, that she's supported emotionally, and that she's happy and content in her work. That people are most important to me.
Mary always has a smile on her face and will make time for anyone that needs it. I've learnt a lot about patient care, respect and dignity from her. She's very aware and respectful of people's beliefs and will always make time to sit down and listen to others' troubles. Mary has such a loving, caring nature. She gave me lots of time to answer my questions. Mary knew that I'm dyslexic, so would always put things in ways and use terms that I could understand without making me feel foolish. She's always smiling, even faced with difficult and stressful situations. Nothing's ever too much trouble for Mary, and she always puts everyone before herself.
So I work as an adult community speech and language therapist. I work out in the community. The majority of my work is in people's homes. We also go out to nursing homes. I see people who've got acquired communication difficulties or swallowing difficulties, and there's a range of different people we work with, from people who've had strokes, neurological conditions like Parkinson's, multiple sclerosis, motor neurone disease, head injuries, people with stammers, so it's a full range. I really enjoy my job. The biggest thing that I find satisfying about it is being able to help people, to empower people, to help people to be able to move forward, to overcome obstacles that are holding them back. To not be able to communicate is a real barrier, and so I'm really passionate about being able to remove those barriers for people.